Your ankle joint is made from 3 different bones. You can think of the ankle joint in simple terms as being a connection between your leg and your foot. Your leg bone has 2 bones inside of it. The largest leg bone is called the tibia, and it's sometimes simply called the shin bone. The tibia is located on the inside of your leg, and you can actually feel the bone of your tibia beneath the skin if you run your fingers down the inside of your leg. The end of the tibia is responsible for the knuckle or bump on the inner side of your ankle. The smaller bone on the outside of the leg is called the fibula, and this is what causes the little knuckle on the outer side of your ankle down in here. Now the tibia and the fibula lock securely around your ankle bone, which is called the talus. A good analogy for this is if my fist is the talus, the tibia and the fibula lock over the top of it like that. There are 3 main sets of ligaments that keep the ankle joint stable. These are located on the inner side of the joint, the outer side of the joint, and also above the ankle joint. The ligaments on the inner side, or medial aspect, of the ankle joint are called the deltoid ligament complex. The ligaments on the outer side, or lateral aspect, of the ankle joint are called the anterior talofibular ligament and also the calcaneofibular ligament. Now, in order to avoid getting too tongue-tied, we usually just refer to them as simply the ATFL and the CFL. You can think of the deltoid, ATFL and CFL as being the main ligaments that connect the leg bones to the ankle bone and the foot. And these are also the ligaments that are damaged with what most people would consider an ankle sprain. Both of the bones inside your leg, or the tibia and the fibula, are held together by very strong ligaments. Now these ligaments all together are known as the syndesmosis. Now these syndesmosis ligaments, even though we can't see them on a dry skeleton model like this, begin life right down here at the ankle joint, and they run all the way up the leg until they reach the bottom of the knee joint. Now a syndesmosis injury is sometimes called a high ankle sprain, and the reason for that is this, is that most of the ankle ligaments that we're aware of are down here at the level of the ankle joint. But because the syndesmosis ligaments run all the way up the leg above the ankle, an injury to that can often be called a high ankle sprain. Syndesmosis injuries are usually more severe than normal ankle sprains, and sometimes they require surgery. Your ankle joint mainly moves in 2 directions, up and down. We call bringing the ankle upwards towards the sky dorsiflexion, and bringing it downwards towards the floor plantarflexion. Now there is also a joint beneath your ankle joint, and this is called the sub-talar joint. And this joint is what really allows your foot and ankle to move from side to side. We call these side-to-side movements inversion and eversion. And you need these types of movements for walking on uneven ground, such as along the side of a hill. They also help with moving rapidly from side to side, like when trying to dodge around an opponent in sport. All of the ankle joint bones are covered in a smooth, spongy substance called articular cartilage. And this is what allows the bones to glide gently over each other without pain. The articular cartilage also acts like a cushion, protecting the bones beneath from too much shock. The ankle bone is actually quite small, less than 5 centimeters across, yet it takes several times your body weight when you run. That's a lot of force concentrated through a very small area. Compare that to the knee joint, which is almost 3 times the size of the ankle. So the ankle joint is quite prone to injury and arthritis if it is damaged or unstable. Ankle sprains are very common. Most people, including myself, have had an ankle sprain or 2 in their lifetime. Now, many ankle sprains do not require surgery and will resolve within 2 to 6 weeks with good quality rehabilitation. But not all ankle sprains are the same, and some patients will require surgery to achieve the best outcome. To help patients better understand their injury and treatment options, I tend to divide ankle sprains into 3 main categories: simple ankle sprains, complex ankle sprains, and chronic ankle sprains. Now, simple and complex ankle sprains are both acute injuries that occur after a specific incident. Chronic ankle sprains are really what happens when a simple ankle sprain never fully recovers, and a patient's ankle continues to be painful or gives way. Now, simple ankle sprains usually involve a lower grade injury to only the ATFL, the CFL, or the deltoid ligament. But the syndesmotic ligaments are not injured, and there is no severe injury to cartilage or bone. Usually the injury mechanism is quite minor, such as tweaking your ankle during sports practice, or your ankle giving way when walking on uneven ground. Patients don't usually describe hearing or feeling a pop inside their ankle when the injury occurred. You may still need to leave the sporting field, but often you can come back on with your ankle strapped. But in general, you are not in horrible pain and you can continue to walk on your ankle. There can be swelling and bruising, but this is not usually major. Within hours to days after your injury, you should be able to walk more comfortably with minimal pain. Yes, you might still be a bit sore and swollen, but overall, things start to improve quite rapidly. In this situation, I would recommend making an appointment with a good sports physiotherapist or podiatrist. They can assess you, and in most situations, you probably won't even require an X-ray or any other scans. The key thing is that you should feel continued improvement day by day and week by week. A return to full activities does vary, but you should be back doing pretty much everything within 2 to 6 weeks. Even if there is significant damage to the ATFL, CFL or deltoid ligament, these can often heal up with scar tissue and don't always require surgical repair. Quality rehabilitation is absolutely essential in recovering from a simple ankle sprain. The main goal is to prevent your simple ankle sprain from turning into a complex ankle sprain that requires surgery. Don't fall into the trap of thinking that because you're already improving that this isn't necessary. You'll put your ankle at much higher risk of re-injury when you return to normal activities. A few sessions with a sports physiotherapist or podiatrist, and then prescribing you a quality rehabilitation program is a very worthwhile investment. Now, some patients will not fully recover from a simple ankle sprain, and it may become a chronic ankle sprain. Ongoing pain, swelling, or their ankle giving way are the common symptoms. If these symptoms don't settle within 6 to 12 weeks, you may have also had a complex ankle sprain which requires further investigation. If this happens, then arrange an appointment with your GP or sports doctor for some further advice. A careful examination, X-ray and sometimes an MRI scan is required to diagnose the cause of your symptoms. And some patients may require surgery for a simple ankle sprain that never really settles down. In this situation, the main treatment options are keyhole surgery or arthroscopy to remove painful scar tissue from the ankle joint, or to treat underlying cartilage damage. Sometimes patients may also require repair of torn or stretched out ankle ligaments. Complex ankle sprains involve much higher grade injuries to the ATFL, CFL or deltoid ligaments. Commonly, they also involve damage to the syndesmosis ligaments, and there is associated bone and cartilage injury. Complex ankle sprains are less likely to recover without surgery, or they may require longer periods of non-operative management compared to simple ankle sprains. The injury mechanism for a complex ankle sprain is often more severe, such as a significant sporting injury, falling from a bike at high speed, or even slipping over in high heels. However, it is also true that a complex ankle sprain can also occur with a relatively minor injury. Sometimes you can just be unlucky. Many patients over the years have shown me photos on their phone of what their ankle looked like a few days after injury, and often they describe it as looking black and blue and puffed up like a balloon. These are not minor injuries, and a lot of force has gone through the ankle joint. In this situation, I'd recommend that you see a podiatrist, general practitioner or sports doctor as soon as you can. Usually they'll start by arranging an X-ray and examining your joint. The X-ray will help to exclude any major fractures. Even though we can't see cartilage and ligaments on an X-ray, major injuries of these structures will often change the alignment of the ankle bones, and we can see that on an X-ray. An X-ray is a very valuable tool for assessing all complex ankle sprains. The best ankle X-rays are with you standing up, putting weight through your joint, because they show us if the joint moves apart due to ligament damage. So if you're not too painful, ask your doctor if they can organise an X-ray like this. If there is a suspicion of a cartilage or syndesmosis injury, then an MRI scan is usually very valuable, as this does allow us to see all the ligaments, bone and cartilage in your ankle joint. If an MRI scan excludes major cartilage or major syndesmotic injuries, then often we can still attempt a period of non-surgical management, but this will be a lot slower recovery than a simple ankle sprain. You may need to walk in a moon boot for 4 to 6 weeks, and full recovery may be 3 to 6 months or longer. Your rehabilitation will need to be carefully overseen by an experienced sports physiotherapist or podiatrist. Otherwise, your long-term outcome will be poor. One crucial piece of advice I have for patients is not to get stuck in a brace or moon boot for weeks and weeks without moving your ankle. If a boot is required for pain management or to support your ankle while walking on it, then that is totally fine. But only wear it when you are weight bearing, and otherwise take it off and get your ankle moving as much as possible. You're not going to hurt your ankle by moving it, far from it. If you remain in the boot for 6 to 8 weeks without taking it off for movement, then your ankle will become very stiff and weak, and some of this could be permanent. Cartilage or syndesmotic injuries should ideally be discussed with an orthopaedic surgeon, so they can examine your ankle, view the scans, and explain the pros and cons of surgery. In general, unstable syndesmotic injuries, where the 2 leg bones have separated, have a very poor long-term result if managed without surgery. The leg bones will heal slightly separated, and this creates uneven stress through your ankle joint, and there is a high risk of ongoing pain and arthritis. Significant cartilage injuries, especially if there is a loose piece of cartilage floating free in the joint, also require surgery. Ankle surgery usually takes place under general anaesthesia, so you will be asleep. It is usually day surgery or a one-night stay in hospital. An ankle arthroscopy, or keyhole surgery, is performed through 2 small incisions on the front of your ankle joint, about 3 to 5 mm in size. You may also require another incision, about 3 to 4 cm in length, on the outer side of your ankle. The ankle joint is inspected with a camera to ensure there is no cartilage damage that needs to be treated. Even the best MRI scans will not diagnose a significant number of ankle cartilage injuries, so arthroscopy is the absolute gold standard to assess and treat this. If there is a small piece of cartilage loose within the joint, then this would require simple removal. If there was a larger piece of damaged bone and cartilage, then this may require fixing back into place with a small screw. Sometimes a large piece of cartilage has broken loose, but it is too severely damaged to be fixed back into place. This may require a keyhole procedure called a microfracture. There is a specific educational video on what a microfracture is and how it helps your ankle joint on my website. We also remove the inflamed scar tissue inside the joint, and this is called arthrofibrosis. Removing this, along with any blood that is set in the joint, will help your ankle move more freely after surgery and reduce the risk of stiffness. If you have a severe syndesmosis injury, where the 2 leg bones have separated, then the first thing we need to do is put those bones back together anatomically. But we then need to hold those bones together securely so they can't move apart and the ligaments heal in exactly the same position. This means that your ankle bones will heal with normal congruity for your ankle joint. We perform syndesmosis surgery with a technology called a tightrope. Now, a tightrope is just a very strong piece of suture material with a small metal button at each end. What we do is actually drill a small hole or tunnel through the fibula and then also through the shin bone or tibia. We then thread the tightrope in between the 2 bones, and with the buttons tie the bones back together securely in their perfect position so they can't move. The ruptured syndesmotic ligaments will then heal back in place over the next 6 to 8 weeks. Once they have healed, the tightrope has finished its job. It's just a temporary holding device until those ligaments heal. there is usually no need to ever remove the tightrope, and it can remain inside your ankle for the rest of your life. Most patients won't even know that it's there. Occasionally, a patient may be bothered by the metal buttons beneath the skin. In this situation, the buttons and the tightrope can be removed with a small day surgery procedure 6 or more months after the operation. If you have major injuries to the other ligaments around the ankle, such as the deltoid ligament, then these may also require surgical repair during the same operation. Suture material is used to repair the torn ligament back down to the bone so that it can heal strongly. Severe deltoid ligament injuries like this are actually quite rare. Severe ankle ligament injuries are commonly associated with fractures of the tibia and fibula. If these fractures have moved significantly from their original position, then they may require what is called open reduction and internal fixation. This involves putting the bones back together and holding them in place with plates and screws until they heal. If we don't do this, your bones will heal outside of their normal alignment and you'll have an incongruent ankle joint with a higher risk of arthritis. These plates and screws may sometimes require removal 6 months later, as they can irritate skin and other soft tissues. If they're not bothering you, then they can actually stay where they are for the rest of your life. They won't do you any harm. Recovery from complex ankle sprain surgery does vary, depending upon the severity of your ankle injury and the exact type of surgery required. In general, most patients could return to study or work within 1 to 2 weeks of surgery. If you have a manual job, you may require 4 to 6 weeks off work. You can download a fact sheet from my website, and this will guide you through the recovery process after your specific injury and surgery. Even though many patients recover fully from a simple ankle sprain without surgery, there are a number of patients who will not. In these patients, the ankle continues to give way, or they repeatedly sprain their ankle, even months or years after the original injury. If you are continually spraining your ankle, then it is likely you have sustained a major injury to the ATFL and the CFL. These ligaments are the main restraint to your ankle giving way and turning in without warning. In chronic ankle instability, the ATFL and CFL are a bit like overstretched elastic bands. They can no longer provide normal support to your ankle. I commonly see patients who describe a reasonably mild ankle sprain, maybe several months or even a few years in the past, but unfortunately they just never fully recovered from it and their ankle kept giving way over time. And this is a classical history of a simple ankle sprain turning into a complex ankle sprain. The muscles and tendons around the ankle joint are also very important to preventing your ankle from giving way. This is why rehabilitation to strengthen these is so crucial after an ankle sprain. But sometimes even the best rehabilitation isn't enough to compensate for badly torn and stretched out ankle ligaments. An ankle that continually gives way is very frustrating for patients, and they lose confidence in participating in regular activities like sport, hobbies, and even work. Recurrent ankle sprains also cause ongoing damage to the articular cartilage within the joint, which is one of the reasons why ankle instability is also painful. This can also have longer-term consequences for your ankle, and in some patients it will lead to arthritis. Fortunately, surgery for ongoing ankle instability or chronic ankle sprains is a reasonably small operation with minimal risks and a very high success rate. Ankle surgery usually takes place under general anaesthesia, so you will be asleep. It is usually day surgery or a one-night stay in hospital. An ankle arthroscopy, or keyhole surgery, is performed through 2 small incisions on the front of your ankle joint, about 3 to 5 mm in size. You will also have an incision about 3 to 4 cm in length on the outer side of your ankle joint. And this is the incision through which we repair those torn and stretched out ATFL and CFL. Sometimes a patient may also have a chronic syndesmosis injury that has not previously been diagnosed. Now you can learn all about that injury and surgery on my complex ankle sprains and syndesmosis injuries videos. Through the small incision on the outer side of your ankle, we locate the torn and stretched out ATFL and CFL. These are then repaired and retensioned firmly back to the bone with suture material. The crucial aspect of this surgery is to securely repair these ligaments in place, as this allows a patient to mobilise quickly and get moving after the surgery. Now, these ankle ligament repairs are not an ankle reconstruction, although many patients and some surgeons might refer to them as that. With reconstruction surgery, we are literally taking a tendon from somewhere else in the body and using that to reconstruct or replace a torn ligament. But the surgery that I'm describing is simply repairing and retensioning the torn ligaments that are already there. Because we're not reconstructing anything, the recovery and return to full activities is much faster. The small ankle wounds are closed with sutures and a dressing is placed on the skin. You may require crutches for 3 to 5 days, but I allow my patients to put as much weight through their ankle as they wish from day one of surgery. The crutches are only really there for pain relief as required. I don't advise my patients to wear a full moon boot after surgery, and you certainly will not be in a cast or a splint. In both professional athletes and weekend warriors, the best results are seen when we move your ankle early after surgery. In some patients, I may recommend the use of a simple ankle brace with Velcro straps to wear only when walking. Otherwise, it comes off to allow ankle movement. Before you leave hospital, you'll be seen by a physiotherapist who will give you instructions on what you can and cannot do for the first 2 to 3 weeks after surgery. Rehabilitation begins from the day after surgery. You will require 1 to 2 weeks of regular Panadol and anti-inflammatory medication. I'll also provide you with some stronger medication that you can take if and when required. You should make an appointment with your own physiotherapist within 2 to 3 weeks of surgery. If you don't already have a physiotherapist, I can recommend one. It makes sense to see a physiotherapist who is close to where you live or work. Otherwise, you'll be much less likely to see them. You could return to office-based work or study within 1 week of surgery. If you have a manual job, then it may be 2 to 4 weeks before you can return to work. And in that situation, I would recommend wearing a brace for 6 to 8 weeks. From 8 weeks after surgery, a patient can typically begin to gently jog in a straight line. A return to full activities can be 3 to 4 months, but your ankle will continue to improve for 6 or 12 months after surgery. All surgery has risks, but in general, I would consider this a low-risk procedure with excellent results. The risk of a deep infection is far less than 1%, but if this occurred, you may need further surgery and antibiotics for a number of weeks. A mild skin infection occurs 2 to 3% of the time, but all that is needed in that situation are some tablet antibiotics, and it's very unlikely there will be any long-term problems. It is not uncommon for patients to have some numbness on the top of their foot. Now, usually this is due to swelling or sometimes even damage to the sensory nerves beneath the skin from the keyhole surgery. This usually improves over weeks to months, but in some patients it may be permanent. It will not affect the stability or function of your ankle. Ankle ligament repair has a high success rate, and in general, your ankle should remain stable. However, if you are unlucky enough to have another bad accident, you could rupture the ligaments again. In this situation, another period of rehabilitation and sometimes revision surgery is required. Longer-term outcomes are also greatly influenced by the severity of the original injury. Patients with associated cartilage injuries or fractures are at higher risk of ongoing pain, stiffness, and arthritis. These patients will also take longer to maximally improve after their surgery. Because I have a special interest in acute ankle injuries, I keep some appointments free every week to see patients who need to be seen quickly. This means I can usually see you within a few days if required, and surgery could be arranged soon after this if necessary. If you'd like to talk to me about your ankle, then please call my rooms at any time to arrange an appointment. If you haven't already had appropriate scans, then I can easily arrange these prior to seeing you.